Hello, everyone. Is it okay if I take this off? Yeah? Okay. Thank you. Awesome. I want to move around a little bit so that I can come a little closer, too. All right. My name is Christina de Silva, and I am the Office of Equity and Inclusion, Welcoming Communities, and Immigrant Affairs Division Officer. I know that's a super long title, and I will be going into detail about the work that we do. But first off, I want to say thank you to everyone who is here and taking the time to learn and connect, especially about this key issue of how we can become a more resilient community. And particularly, I'm really grateful that you all as faith-based leaders are taking this role within your communities and bringing that back to your congregation. I think that's amazing. And, I'm really proud that Dallas has people here that are committed to this work. So next slide. So I'm going to be going over basically a brief overview of the racial equity initiatives that the city of Dallas has undertaken for the past 6 years. And then I'll be sharing a little bit of information about data on the Dallas immigrant population. And then I really want to give a snapshot of the work that we've been doing specifically here in Dallas and how our city has been partnering with local nonprofit organization, faith-based communities even, on how we have removed barriers and created opportunities for immigrants in Dallas. And then finally, I want to equip you all with action steps that you can take back to your congregations on ways you can get involved now that would allow us to stay connected, and you can take some concrete action steps with your community. Next slide. So I always like to start off. Has anybody ever seen this image before, where you have, these three people? They're standing on a hill and they're standing on three boxes. Okay, and you've seen the difference. So how many people have seen this before? Okay. So you see here on this hill on the left side, it's describing equality, right? Everybody's standing on the same type of box. But that doesn't mean that they're getting the same kind of perspective or the same kind of outlook, same kind of opportunities in life. And so at the City of Dallas, we are really striving towards equity. And you can see on the next side of the picture, you have people standing on different numbers of boxes that really shows how the outcomes are resulting in more people being able to have a better outlook on their lives, right? So I always like to show that and also talk about our mission. Our mission is to advance equity, inclusion, and social justice so that all Dallasites can thrive. And we know that Dallasites, our Dallas residents are very diverse, and that means that the way that we tailor our services is going to look differently. That might seem like a simple concept, but in reality, that is also very challenging for people to understand, right? So just wanted to kind of put that as a foundation for our understanding of how we operate. Next slide. So as I mentioned, we have our mission statement for our office, but the city of Dallas has actually been going through a journey, you could say, with the whole city in understanding how we can become the most equitable city in the U.S. It started with the Resilient Dallas Strategic Plan. Have anybody heard of the Resilient Dallas Strategic Plan? Okay, basically the Resilient Dallas Strategic Plan was really looking at how the city holistically could become more prepared against shocks, which might be like short-term storms or small events that kind of disrupt systems. And stressors, long-term stressors, for example, poverty, maybe climate change over a long period of time. How can our city become more resilient towards that? And so that was one of the first steps that our city took to understand in different areas and different aspects, how can we become more resilient? And one of the areas that was found was one of the ways that we could become more resilient is becoming a more welcoming and inclusive city for immigrants. In 2019, I think this was kind of a big step for our city. We published what's called the Equity Indicators Report. The Equity Indicators Report took data from different sources, for example, the census, from public health institutes, et cetera, and they looked to see what populations in the city were experiencing really high outcomes, like positive outcomes, and which populations were experiencing low outcomes. So for example, when it came to life expectancy, one of the indicators that we're reviewing is who is experiencing the best life expectancy and who is experiencing the lowest life expectancy, right? And comparing those two and understanding why is it that if you're Black and you're living in South Dallas, you're expected to live 8 to 10 years less than somebody who's white living in North Dallas. It's the same city, but you're losing years of your life. And so in a way, you could almost say this is Dallas airing our dirty laundry because we're showing the disparities that exist. But I think it was the first step of us naming the problems and us also having a data-driven approach to addressing with solutions. Now in 2020, we, obviously we're dealing with a pandemic. We were able to, goes back, yeah, sorry. 2020, we were able to use the Dallas Equity Indicators Report to also help us prioritize where to distribute resources, right? We knew that certain populations were disproportionately impacted by the COVID-19 disease. So we wanted to make sure that where we were distributing our testing sites, where we were distributing our PPE, that they were actually going to the places that needed it the most. And so we created an assessment tool that included data, not only from the Equity Indicators Report, but also from other sources to understand here are the priority areas. And that was like the first time that I think we were able to equitably distribute resources and have that play out in live action.
That's wonderful.
Thank you. In 2020, we've also gone forward with our broadband and digital equity. I won't spend too much time on that. Just in general, understanding how important internet access is, especially for communities who don't have access to hardware or internet. And then most recently in 2022, our City of Dallas passed the Dallas Racial Equity Plan. So the Dallas Racial Equity Plan continues this work of looking at data and then understanding how each department is going to take a responsibility and ownership over closing the disparities that exist. So for example, OEQS, Office of Environmental Quality and Sustainability, they have named specific actions that they will take to close the disparities that have been named in the Equity Indicators Report. And that's all public. And we are actually going to be in the process of creating a dashboard so you can, as the public, can review where we are in terms of progress. And I encourage you all to, push us a little bit, right? Ask questions on, why are we not making the progress that maybe we said we would be making? Yeah, that's, I think, wanted to kind of give you understanding that the city has been doing a lot of work around understanding equity and implementing initiatives to close those disparities. Next slide. So before we go any further, I want to make sure it's clear that an understanding of who an immigrant is, right? Immigrant is a very general term. As someone who is born outside of the, who's living in a country that's other than their country of birth. Yeah, I don't know why there's that link there, but I'll just ignore it. Let's see here. So approximately 24% of our Dallas population is actually an immigrant. And of that 24%, 26% are naturalized citizens. So that's all to say, I'm really bad at math, but it's like 80% can be from a lot of different other types, 70%, 75%, can be from different other types of statuses, right? You could be a refugee. That means someone who has a real and evidence claim for fear of returning to their country. You could be an asylee that's also trying to seek refuge because you're afraid of returning to your home country. You could be here on a work visa, maybe because a company needed your talents here in the US, and so they provided for your work visa, or maybe you might be an international student. So it could be a lot of different diverse statuses, right? I just want to make that clear that when we talk about immigrants, we generally talk about them generally. We don't really make that many distinctions, only when we're trying to provide services that address their needs. Next slide. So in terms of the Dallas immigrant population, 30% of our workforce are immigrants. They also make 30% of our entrepreneurship. So as you can see, our local economy is growing because of our immigrant population. And also, we have a very diverse immigrant population. The top six languages spoken is English, Spanish, Amharic, Vietnamese, Korean, and Chinese.
What's Amharic?
It's actually a language that's from Eritrea, Ethiopia. It's actually very closely related to Hebrew. It's a very ancient Semitic language, actually. And they're like a fascinating community here. They have just amazing history, so highly recommend you learning about them. But yeah, they actually, we have, Dallas has been just for decades been a city that's received folks, attracted folks for a lot of different reasons. Obviously, economic. I actually think that the reason why we also attract people is because we have strong faith-based communities here that recognize the value of supporting and welcoming folks who are fleeing from danger. So yeah, I think I think Dallas is definitely a city that's attracted people from all over. Next slide. So in recognizing that Dallas is a global city, right? In March 2017, the city manager established the Welcoming Communities and Immigrant Affairs Division office. Our goal has been primarily to identify what is it that the city can do as a local government to support immigrant residents. And I think at that time, it was a little bit of a shift, right? For the most part, when you think about immigration, you think of it from a federal level, or you think of it from a state level. This was the first time where the city of Dallas was realizing we also, as a local government entity, have a role to play in supporting our immigrant residents. And so we established the WCIA office. Next slide. And then we also identified individuals who had already been doing a lot of work in Dallas. There have been a lot of advocates, champions for inclusion. And so, we didn't want to say like, oh, we're going to start it all on us. We wanted to make sure that we were working closely in tandem with community partners who understood the community and understood the gaps and areas that we needed to improve on. So we established the Welcoming Task Force. Through this Welcoming Task Force, we established a community engagement process to understand what the needs were. We had surveys, we had listening sessions. At that time, this was 2017. Maybe you might remember there was a lot of federal rhetoric happening at the time that was very xenophobic at the state level. SB 8, okay, yeah, sorry, I'm not originally from Texas. I moved from Oklahoma, so we had similar laws, so I kind of sometimes get them confused.
You're also
Yeah, actually, yeah, it's, so yeah, I'm still learning the systems here. But yes, at that time, the number one barrier that was named was fear of immigration enforcement, and I think, again, given the rhetoric that was happening at the time, it was valid fear. There was also language barriers that were existing, and also just having difficulty accessing resources, transportation, and affordable housing. So these were the top biggest barriers that I wanted to name. We also identified what were some of the biggest needs. It's, I'm sure, pretty hard for you to see. It's even hard for me to see. So yeah, I just wanted to name those top big barriers because it was based off those barriers that we were able to then develop the Welcoming Dallas Strategic Plan. Next slide. So we had our Welcoming Task Force break out into committees, and we were able to draft the Welcoming Dallas Strategic Plan, bring it up to City Council, and I'm proud to say that it was unanimously approved in 2018. And since then, our office has been implementing the actions with our partners and working towards that vision of becoming a welcoming city. Next slide. So here's a snapshot. Our Welcoming Dallas strategic plan is broken up into 5 areas. One is leadership and communications. So we want to try to use our platform as a local government entity to not only increase awareness about our local immigrant population, but also to serve as a hub for connections. So we provide resource referral. We also try to connect our local service providers with resources so that they can increase their capacity. We also have a Welcoming Week celebration, which is actually going to be September 9th through the 17th. Invite you all to participate. Your congregation can, we've done a lot of different things. This is actually, you can see our City of Dallas Youth Commission. They were sharing multilingual welcoming messages during Welcoming Week on their social media campaign. But there's a lot of different ways that people can get involved. There's a website that also shares resources. So like if you needed social media or communication templates, that's all available to you. You can edit it so that it's branded towards your group. But yeah, I wanted to make a plug for Welcoming Week. Healthy, safe, connected communities. We have our Dallas Safe program, which is actually a publicly funded legal defense program for Dallas residents who are in deportation proceedings. We work with a nonprofit to provide a pro bono attorney and wraparound services. I'll skip some things, but I wanted to point out equitable access. We've been working towards increasing language access for our meetings. We actually have 2 interpreters here that are available whenever we're hosting a public meeting. We want to make sure that people have access to interpretation. And then also, we've been partnering with our local public library to create what's called an enhanced library card. I don't know if anybody's heard about this before. This is actually I think it's pretty cool. The library has a card. When you get a library card, right? What the enhanced library card is basically has your face, it has your picture, it has your name, it has your address, and it also expires. But what the point of this enhanced library card is, the goal is to provide identification support for people who have difficulties accessing a state or federal ID. Now, it's not going to replace it, right? You can't use it to access everything, but our goal is that it's a stepping stone to get access to a driver's license or a passport, because sometimes people just need something to get themselves started, right? So we've created this enhanced library card to basically, provide that support. And our goal is that at minimum, you could be able to access city services, so like parks, utility bill, et cetera. If it's open to anybody. My goal is that everybody gets one, because I think that we don't want this to be branded as like, oh, this is only the immigrant card. We want diverse populations getting this card. And ultimately, my hope is that it could become something fun where you get discounts, et cetera. But that's me dreaming kind of big down the road. Thank you. And then, of course, we have our economic opportunity where we're working to support immigrants who have been internationally educated. A lot of folks have, for example, a degree or work experience. They sometimes have a hard time getting a job that meets their skill. And oftentimes we have these workforce gaps that they could fill. So that's just like a snapshot of the work that we do. Next slide. All of this work has actually been recognized. We work with a nonprofit that's a national nonprofit called Welcoming America, and they do an audit on all of our policies, programs, and partnerships, and they see how it aligns with what's been proven to be best practices. And I'm proud to say that we are actually the first certified welcoming city in the state of Texas. So it's a pretty rigorous audit, but I think I'm pretty proud that we have this recognition. Next slide. So how can you get involved? Well, we've worked with partners to develop what's called the Welcoming Newcomers website. And basically, it provides a list of all the ways that individuals or groups can volunteer with our local refugee resettlement agencies. And also, if you, for example, own a business, if you're interested in hiring people who are immigrants or refugees, there's ways to do that. I put a QR code. I'm worried that maybe the website might not work. So I don't know if there's a way we could follow up with people. Okay. Okay, so yeah, you can find our website also, city@dallas.com/WCIA. I can make sure to share that. But yeah, does everybody get their picture? QR code scan? Okay, next slide. Another thing I wanted to plug for everyone is, I'm sure, as you know, Texas being a border state, we have received a lot of folks from the southern border. And I would argue there are even many who are climate refugees, people who are fleeing. Oh, wonderful. What was your experience like?
I've been volunteering with Dallas Response for over 8 months. As I talk with refugees, especially from the Caribbean and also from the west coast of South America, many of them are climate refugees. And one of the problems we have, they are coming as asylum seekers, and the State Department does not have a category for climate refugees.
Yeah, it's a challenge, and I appreciate you sharing, because yeah, we have a lot of folks who are fleeing the drought, they're fleeing the natural disasters.
Many of them were farmers who lived in mountainous regions, and their entire livelihood, everything they had washed down the side of the mountain during hurricanes and other natural disasters.
Yeah, and I
probably 10% of them settle in the Dallas area.
Yeah, I think, that's from, especially from the ones that pass through El Paso. Yeah, I think we're named at least top 3 or 4th destination. I think your point about how our federal policies do not necessarily align with opportunities for these individuals. But I think that's where I think we as a local community, I don't know, maybe it's me being biased, we just move forward, right? We move forward and welcome folks. And yeah, and I was gonna say, this is a way you can get registered. You scan the QR code, register to get volunteers. I'm glad you had a positive experience. I posted this article that came out. It was a 9-year-old volunteer at the Dallas Response Center. Do you know him?
Yeah.
Okay. It's a really cool article. It just talks about how he's engaged. So I feel like it's an opportunity for anyone. It doesn't mean you have to speak Spanish or...
And there are a lot of different opportunities. One of the biggest needs that we have are people who can transport people to the airport and
Right.
stations. And you don't need to be bilingual. Google Translate does wonders.
Yeah. So I wanted to share that we partner with Dallas Response. Essentially what they do is they're a nonprofit that helps migrants who are coming from the southern border. Sometimes they choose Dallas as their final destination because they have family contacts here. A lot of times too, they are trying to get to other contacts in other parts of the US. So Dallas Response just creates like this humane, safe way for them to get connected to their final destination. And they do a great job. Next slide. And then they also have an Amazon wish list that I wanted to plug. They're always needing materials. It's kind of sad. You see some people come and they literally don't have anything. Families that have children, young children, it's hard, but it's hard to see. But I'm happy that we have a community here that's ready to receive them and help them. Next slide. So that's basically concludes my presentation. I wanted to provide my email address, my phone number. That's my work cell phone number, so you can text me. We also have a Facebook. Unfortunately, that weird link is blocking it, but it's at Dallas WCIA. So you can follow us on Facebook. We're always sharing opportunities of how to get plugged in, or if you want to message us and have us come to your congregation to share information or listen, let us know.
Well, my name's Chris Herzog. I'm the lead instructor for the Dallas CERT program that we have, and it's under the auspices of the Office of Emergency Management in Dallas, and that's what I'm going to be talking about this morning. Wish we had a clicker, but we don't, so I'll be telling them to advance quite often here. Any of you familiar with CERT? You are? Okay. Okay, just go ahead and advance. And if you can, since it has a lot of advances, just advance every slide down until you see the green star in the lower right-hand corner. That's the last animation, okay? So you can go ahead and, there you go. So EOC, Emergency Operations Centers. That's where we coordinate all of the responses we have when there's an emergency in our city or a major event like the Super Bowl, those type things. So it's the basement or underneath the city hall. And when you're down there, it's impressive. It has about 45 people, 45 stations, and they can communicate from every agency, not only throughout Dallas, but throughout Texas, and can even reach all the way back to Washington. So we determine when we stand that up, it's called, depending upon what kind of activity is going on in our city. So advance. So there are the blue sky days, which would be like when everything's normal. When everything's normal, we would just go ahead and continue to prepare for the times it's not going to be normal, right? For the next tornado that comes through, for the next weather event, or any natural disaster, or even man-made disasters. The blue sky days, that's when we start showing up down there, and depending upon who and what is affected, show up. Whether it's a law enforcement, whether it's a terrorist, then different people are staffed down there than if it would be a weather event. So it's, sadly, we've been using it a lot lately with everything that's been going on. But without it, I don't know what we'd do without it, because the communication's tough enough across all the different agencies in order to communicate effectively. And we can always get better at that, for sure. Okay, advance. There you go. So how many of you know when you hear the sirens go off? If you can't hear them when you're in your house, what do you think about that? Do you think that's a problem and that you need to let us know? We get a lot of calls from people, from residents that say, I can't hear the sirens go off when I'm at home. You're not supposed to hear it inside your house. It's meant for people outdoors that's doing some outdoor activity. If you hear a siren, you're supposed to go indoors, turn on your radio or TV, and say, there's something going on I need to become informed about. So then start gathering information so then you can make appropriate decisions for you and your family. Okay? But right now we have about 180 sirens on poles, and it's constantly being added to, just so that way we get the best coverage we can, because we do want to be able to reach everybody in the event. We also have the integrated means of being able to reach you. We can also reach out and touch you with your cell phones, and even send messages to your landline at home and notify you that way. So you have to sign up for it, and when you do, you're notified just with a quick text that there's an event going on that you might want to know about.
How do you sign up for it?
Just go to our website, go to Office of Emergency Management website, and you should be able to navigate it through our bar at the top. Okay, just advance. So now CERT objectives. Again, Community Emergency Response Team. That was really initiated after 9/11, and every city in America is supposed to have a CERT team on it. Dallas is pretty fortunate. It's a pretty active CERT organization, and many of the surrounding communities come and train with us because we've been doing it a while. I've been involved in CERT for about 12 years. I'm a retired airline captain with American, got bored at home, and my wife wanted to get me off the couch, so she signed me up to take this training. and really enjoyed it. Had to do with managing emergencies. And I spent 35 years with the airlines managing emergencies at 35,000 feet, so I figured it could be a lot of fun and pretty easy doing it on the ground. So next thing you know, I'm teaching it, and then I'm in charge of the program. So what we want to do is try to get as many of our citizens prepared for whatever we know is more than likely going to occur. We really can't say when, but be prepared for it. Okay, advance. So in order to do that, you need to be prepared for all kinds of hazards, not just for weather events, but there could also be, let's say, the nuclear power plant that is down there at Comanche Peak. What if they had an accident there? Well, we'd have about 6 hours to get ready for a plume of pretty deadly cloud of radiation coming our way. What's your plan? If we notified you that that occurred, what would you personally do for you and your family? So what we do, we teach families, we want everyone to be more self-reliant and self-sufficient to take care of themselves, because if they don't become a victim, then there's fewer victims than the professionals have to take care of. So we're constantly trying to teach you on how to provide for your own food, water, medicine, and electricity on your own, so that way you'll be there to help your neighbors because you're not one of the victims. Okay, advance. And then when an event occurs, you can either respond in your neighborhood. Let's say a tornado comes through your neighborhood. You don't need to wait for the professionals. Just get up and do what we trained you to do as a CERT member and start responding immediately in your neighborhood. You're the first responders. And then we'll notify OEM, which is EOC then would stand up a team, and then they would hopefully start sending responders to you. But in a big event, you could be on your own for days. We teach you, you can take care of yourself and your neighbors for 6 hours up to 6 days. So if you set up a field hospital because of a lot of injuries in your area, could you care for them for up to 6 days and keep them alive? So that's what the training's about. So I personally have trained about 4,280 residents so far on this training. It's about a 20-hour course, and we put you through disaster simulations, and we are what's called force multipliers with the Dallas Fire and Rescue. So we're trying to do is expand the volunteer base as much as possible, because it makes the city much more resilient. It bounces back so much easier after a disaster if we have more and more people trained to take care of themselves. And then if you take care of yourself, you take care of your neighbors. Help with your neighbors. Okay, advance. So you want to identify the type of hazards, because you're not always sitting at home when something bad happens. What if you're at work? What if you're at a volunteer event? You're across town. What if you're driving? What's your plan? So I'm always picking on people in the audience. What's your plan if, and then I give them some scenario. Even though people think they're pretty prepared, but if you don't have a plan, you know what the saying says, it's not going to work out well. And then what's the role of CERT in our city? Again, we respond immediately if it's in our area. If it's not in our neighborhood or something, then we wait to be activated. Then we show up and we assist the professionals, and we're force multipliers. Like when the tornadoes came through Rowlett and Garland area, there's about 110 of us that showed up that night, right after Christmas. I think it was around the 26th. And the first thing the fire department asked us to do was to go ahead and turn off the natural gas for this entire subdivision, 780 homes. And they said, get the gas turned off. And that way they did such an easy thing to do, but without training, you could make things worse. And yet it didn't use up any of the professionals where they would be better used doing something else. So those are the type activities that they ask us to do. Okay, advance. So we teach everyone to identify what possibly could go on. Like we'd ask everyone in the class, and our average class size is anywhere from 40 to 80 people taking the class. And then we say, I know what I want to cover. I said, well, what are you most worried about? And tornadoes are one of the big ones, but it could also be terrorism. It could be biohazards. and things of this sort. So we make sure that they have all their questions answered and they can take care of themselves and their families, regardless if they're in a home, apartment, condo, anywhere, and have the supplies that they need. You probably heard the term of a 72-hour bag or a go bag. Okay, that used to be meant to have enough supplies to take care of you for about 3 days. Then in September of 2015, FEMA put out an email, I'm sure you got it too, that now instead of be prepared to take care of yourself for 3 days, the feds are saying, no, you need to be able to take care of yourself for 14 days, for 2 weeks. He said, don't expect any help from the government for 2 weeks. Can you take care of yourself? No matter where you're at, either in your home, in your car, at work, at church, whatever. So now your go bag got a little bigger, didn't it? Well, a lot of people never got that memo, okay? Probably because they didn't want it to get out there, right? So if we're responsible taking care of ourselves and our loved ones for 2 weeks, that takes a little bit more thought on making sure you can do it at home. And that's food, water, and means water's not coming out anymore. Your own water, not coming out of the faucet, okay? And food, water, medical, and your own electricity. And we know here in Texas with our grid situation how challenging it is when you lose electricity. So we're big on making sure you can provide and meet your own electrical needs to get by, okay? Advance. So how long is the training? It's about 20 hours. It's usually 2 consecutive Saturdays, 8 to 5, 8 to 5. And then the third Saturday is a half a day, and we put you through a disaster simulation. And we train down at the Dallas Fire and Rescue Facility down on Dolphin. So they give us the entire campus on the weekends. So we put you through a pretty tough event. But it's amazing how confident everyone comes out and excited. They didn't think they could do half the stuff that we asked them to do. Because we probably have 50 to 100 victims that show up hours before you guys show up and have makeup put on called moulage, which would be all the injuries. And then we'd spread them out in a 6-story concrete building and throughout an area, maybe even in cars. And then you have to go rescue and save as many people. And then we keep track of how many dead bodies we end up with. And you're graded on how many lives you saved. And set up a field hospital, keep everybody alive, and then we have instructors and coaches watching it all so we can say, did you diagnose correctly? Did you treat correctly? Because the training teaches you to be able to come across someone that's dying at your feet, and you have to diagnose what they're dying from, treat them, and then move on in 60 seconds. Because it's mass casualty. If it's just me or just us and we're in a big facility of maybe 500 to 1,000 people and something happened, the ceiling caved in or trees fell over or tornado or whatever, there's going to be a lot more victims than there are going to be responders. So then you're outnumbered. So then you have to do the greatest good for the greatest number. So you don't want to waste your time helping people with just a broken leg or someone that's not dying. I want to get to everyone who's dying as quickly as I can because they could be taking their last breath. They could be bleeding out in another 30 seconds. I got to stop that bleeding. I got to get them breathing, those types of things. So that's what we're training them to do as quickly as we can. Okay, advance. Again, that just shows you some deals, even teaching you how to raise a 20,000 pound concrete wall off of an individual. Because if a wall collapsed or an air conditioner falls off the ceiling and lands and traps somebody, how are we going to get it off of there? We teach you with just 4 people and a crowbar how to rescue people. And it's amazing how much weight you can do with the proper understanding of leverage and things of this sort. Okay, advance. Then, once you're trained as a CERT member, everyone wants you to volunteer because now you're showing up with so many more skills. We really volunteer a lot for and whenever there's any type of activities in Dallas for the different activities. And they also want us to be victims for them because now we're trained to be able to act out the injuries a lot better and can just work in a lot better environment because they do a lot of training at night on DART. In case there's active shooters, we do a lot of active shooter training, and we volunteer as victims for them and things of this sort. And whether it's a 10K run or any other kind of activity, we're always there to help. Just nothing else, passing out water, but we're also trained to manage heat stroke and other type things until help arrives. Okay, next slide. And then we have continuing education after that. So once you can just stop at basic cert, or if you want to learn a lot more with your skill set, we can keep you learning every weekend. I mean, you do a lot online. I'm even teaching online now. We did that during COVID, during the pandemic, where we couldn't teach in person, so we started teaching online. Now we still do teaching online. We start one coming up on the 8th of, on Friday, I think the 8th of August. Next slide. We also teach how to set up a shelter. So we have different parishes, different churches in the area that have done a lot of CERT training, and we even teach them how to set up a shelter in their facility and how to manage a shelter. We teach Red Cross sheltering, so whenever there's a Red Cross event that needs volunteers, we help stand up the shelter. During Hurricane Harvey, there's hundreds of us that participated in that event. And all the other different activities you see up there. But there's plenty of different training to take as we go. And parishes are calling us all the time, asking us to deliver training. There's some parishes that maybe 10% of their congregation has taken the training. And then they ask us if we would come out and put them through a disaster simulation in their building. And then we accommodate that and teach them how to set up a field hospital and how to rescue people out of the main sanctuary in the event of whatever it could be. Okay, next slide. Right now, the teams are divided up into 3 groups throughout Dallas. They have the south, the east, and the north, zone 1, 2, and 3. And with over 4,000 members that I've trained, they have different training events, different meetings, so you get to know your fellow members that are trained, so that way you can quickly respond in your neighborhood and know who other CERT members are and have rally points situated and even have supplies and even have trailers, pre-positioned trailers with medical supplies, so you can quickly get there and set up the hospital and help start treating victims. Okay, next slide. Frequently, groups from these organizations, whether it's volunteers on patrol, HOAs call us frequently and want to get their neighborhood subdivision all trained up, so that way they feel like they're a lot more secure if their neighbors have been trained. So we reach out to a lot of different organizations, and they sometimes train as a group, and we recommend that. Next slide. So again, the biggest thing here is that the houses of worship that we've gone through, they want to make sure that if something, say the easy one, say weather event comes through and takes off the roof of the main sanctuary, now you've got, 500 to 1,000 possible victims. Who does what, when? So then go through the basic training first, then pull me out to your facility, and then we'll craft something and practice training right there, and then make sure you have the supplies needed. So you got the training, the supplies, and then you're better prepared in the event something happens. And that could be even, sadly, to active shooter type things. So more and more parishes are calling us doing that. Next slide. So then, if it's not in your neighborhood, but it's somewhere close by, you'll be notified probably through a text message through your phone on where to the rally point. And if you want to volunteer, just because you take the training, you don't ever have to volunteer ever again. Okay? Just use the training to keep you and your family safe and protected. But if you do want to volunteer, then they'll tell you where the rally point is and what's expected. Okay? A big thing is making sure you have the proper equipment and what your neighborhood needs, and whether it's chainsaws to help clear the roads, or whether it's medical, or whether it's treating special needs patients that you are aware of in your neighborhood, all the everything that's imaginable. Next slide. And then the big part, probably heard me say more word than anything else, would be the field hospital, is setting up a field hospital to treat the injured and to do that in an organized manner. Similar to, probably remember that movie MASH. That's the same way the MASH units were set up. How can you quickly triage a large group of people and get to the people who need it the most? And that's the training that we stress. Next slide. And then when they're trapped, how do you get victims out from being trapped? A lot of times with earthquakes and such, a lot of volunteers want to help because it's their family and friends that are trapped. Next thing you know, we have a lot more victims, and no one really got freed because they didn't know what they were doing. They let their emotions jump involved, and next thing you know, they get hurt or they're trapped, and frequently a lot more deaths occur because of that. So we want to make sure you do it properly and safely. Some of the activations we've had was the gas explosion in '07, the flood, of course the hurricanes, the tornadoes, and the last one was Hurricane Harvey. And then we did a lot of work with the pandemic, helping different events that the city needed volunteers to help with maybe the vaccinations, those type things. So they're using us more and more. The small towns generally use them even more than the big cities because the small towns have a lot smaller budget and they don't have as large of a professional group of first responders as a major city does. Okay, next slide. And then just stuff like today, just going out and giving talks, manning booths, distribute materials, just trying to get people more informed, encourage people to take the class. Those type of things. So again, I'd like to encourage you all, if you're interested, just go to DallasCert.com, and the next class I have one online the first Friday in August, and then that's just an intro, a 3-hour thing I teach at night, and then the class begins the next Saturday, 3 consecutive Saturdays in August. We usually teach about 4 to 6 classes per year. One year, when there was a lot of activity and I had plenty of other instructors, we taught 17 classes in 1 year, all over the city, and just about killed us. So, but if the demand is there, if they'll call us, we'll find a way to get there and teach class. And in enrolling, just go to, again, DallasCert.com, click on the apply button and apply, and your application will come straight to me, and I'll email you some homework right off the bat and get started. So other than that, next slide. The program manager is Cassandra Wallace. She manages the program. She was here when it started. I'm the lead instructor. So if you want to reach out and ask more questions about the program, probably call me. I'm part-time. I have a lot more time to devote to this than Cassandra does. So reach out to me. I'll be happy to help you. But that's it.